start again. My name is Adityavarman Mehta. I'm a PhD researcher at the University of Leeds. My research examines the intersection of conflict, peace building, and global health diplomacy. Specifically, my research examines the role of global health diplomacy as an instrument for peace building in the context of the LRA war in northern Uganda. Now, this is how I've been introducing myself for the last 4 years. Don't get me wrong, it's all true, but in addition to global health diplomacy, I want to talk about another instrument for peace building, which is Bollywood. Now, of the many reasons to speak about Bollywood today, one of the main ones is that it runs in the family. My grandparents, my parents have watched films all their lives, listened to their music, and that has passed down to me. But I didn't realize the impact of Bollywood until I started conducting conflict and global health research in Africa. But before we talk about Bollywood, let's talk a little bit about the LRA war in northern Uganda. So the LRA war took place over 2 decades in northern Uganda. It devastated entire communities. Hundreds of thousands of people were displaced. Thousands of children were abducted. Amidst this violence, there was another struggle, disease. The emergence of HIV/AIDS, an Ebola outbreak in 2000, which was Uganda's first ever Ebola outbreak. Because conflict rarely comes alone. It is accompanied by epidemics, by malnutrition, by trauma. This is where global health diplomacy enters the story. Global health diplomacy is an interdisciplinary framework which combines the disciplines of international relations, global health, and public policy to improve health outcomes. Now, this may sound technical, but its essence is human, because health interventions can help us find common ground during conflict. One example of this is during the Ebola outbreak of 2000. It was widely reported at that time that there was significantly less violence, and this outbreak was countered by experts from 27 different countries who collaborated with local authorities to quell the outbreak. Sometimes health can open doors that politics cannot. It creates opportunities to build trust. Trust between communities and institutions, trust between humanitarian organizations and local leaders. Now, you may be wondering, what does any of this have to do with Bollywood? Everything. Because health diplomacy improves public health, stories facilitate healing, they offer hope. Global health diplomacy, through immunizations, disease outbreaks, humanitarian action, saves lives. Bollywood entertains millions through emotional storytelling, songs, dance. Both have something in common. They facilitate social cohesion and trust building. And lots of research indicates that social cohesion is an essential pillar of peace. When we reflect on peace building, we think of politicians, mediators, ceasefires, all of which are enormously important. But after years of studying conflict and global health diplomacy, I found that peace is often found in places that are rarely noticed. In clinics, in schools, in communities, and sometimes in cinema houses. In many conflict-affected societies across Africa, Somalia, Sudan, Nigeria, Uganda, stories are not consumed just for entertainment. They're often consumed for emotional survival. And Bollywood has been a remarkable example of this phenomenon. I vividly recall my first day at work in Somaliland when my Somali colleagues welcomed me with a perfect rendition of a Bollywood song. Later, I discovered that Bollywood was an integral part of Somali culture. And I found that Mogadishu, for example, had a multitude of open-air cinemas, which often required vehicles to drive around neighborhoods to announce new films and stars. This is not too dissimilar from a small Indian town where something similar would happen. And I found that, popular Bollywood stars like Amitabh Bachchan, he had his own Somali nickname. He was called Kali Dhire, which translates to Tall Ali. A very popular villain called Amrish Puri, he played many iconic negative characters. He was called Indagulus, which translates as button eyes. So they basically made Bollywood their own. An anthropologist called Brian Larkin wrote extensively about the influence of Bollywood on northern Nigeria. In a city called Kano, there is the Maraba Theatre that you can see here. Films were often screened, Bollywood films were screened 5 times a week. And on one occasion, when Larkin went to watch the 1957 classic called Mother India, he watched it in a packed Maraba theatre, and a Lebanese distributor at the time told him that he had been screening that film for decades, and it could still sell out at any theatre in northern Nigeria. Larkin was told that night that everyone in the cinema had watched Mother India at least 15 times. Similarly, at the Juba Picture House that we see here in present-day South Sudan, the 1956 film Chori Chori, directed by Raj Kapoor, was hugely popular. And it became popular in a time where Juba had a very limited Hindi-speaking audience. The thing is, Indian cinema offered a vision of life beyond conflict, an escape from reality, not because it ignored suffering, but because it reminded audiences that suffering was not the end of the story. There was always hope. So why is this important? Because peace building is fundamentally about narrative. Every conflict is driven by stories. Stories about who belongs, stories about who's a victim, stories about who's an enemy, stories about the past. Peace building requires new stories, stories about coexistence, stories about shared futures, futures that alleviate the suffering and the trauma of the past and the present, stories about healing and hope. Bollywood films historically have offered hope. Think of the structure of a classic Bollywood film. There is conflict, there is loss, there is separation, there is struggle, then there is reconciliation, the possibility of a better future. One of the greatest misconceptions about peace is that it begins when violence ends. Violence may stop on a certain day, but peace takes decades. It takes decades to restore relationships, rebuild trust, reintegrate former combatants. This is why much of the peace-building focus in northern Uganda was on the reintegration of former combatants. This process is as psychological as it is political. I interviewed a former combatant who told me quite explicitly that he benefited tremendously from the psychosocial help that he got upon his reintegration. This is where global health diplomacy and Bollywood converge. Mental health experts have always said that recovery needs hope. People need to believe that healing is possible. Communities need narratives that support resilience. In northern Uganda, survivors of the war experienced profound psychological trauma. That trauma still exists in conflict-affected communities. Former child soldiers have often struggled to reintegrate in their communities. Families struggle with grief. The real challenge is not always building roads and clinics. The challenge is in rebuilding meaning. Meaning often emerges through stories, whether stories come from religious teachings, whether they come from local traditions, or whether they come from Bollywood. There's a common purpose, which is to expand the boundaries of possibility. There's another lesson here which expands beyond Uganda. The world today is increasingly polarized. Wars continue, forced displacement continues, epidemics continue. People may feel that diplomacy is failing, but perhaps we've been looking for diplomacy in the wrong places. Perhaps diplomacy is not what always happens in ministries and embassies. Perhaps diplomacy also takes place when health workers negotiate access to vulnerable communities. Perhaps diplomacy takes place when vaccination teams are able to cross conflict lines. Perhaps diplomacy takes place when communities gather around stories and talk about shared humanity. At its best, Bollywood helps us see ourselves in other people, recognize a common humanity, expand empathy. Because empathy is one of the most powerful peace-building tools out there. Now, imagine a world in which cultural exchange is used as a tool to engage constructively with adversaries. Imagine a world in which we spend enough time on rebuilding trust as we do on rebuilding infrastructure. This world may seem idealistic, but fragments of it already exist. We see it when health workers go to dangerous areas. Think of the ongoing Ebola outbreak in the eastern DRC right now. We see it when stories travel across borders and people imagine lives different from their own. A child in a conflict zone watches a film and imagines a future beyond violence. I began by talking about the convergence between Bollywood and global health diplomacy. Let me end there. A child in a conflict zone may never meet a diplomat, may never read a peace agreement, may never attend a conference on global health diplomacy. But that child will experience the consequences of all of these things through access to health, through opportunities for education, through safer communities, through stories that shape an understanding of the world. Peace is not only built by those who sign agreements, it's also built by those who heal, by those who tell stories. Global health diplomacy teaches cooperation to save lives. Bollywood reminds us that imaginations save futures. And enduring peace emerges when the two work together. When we heal bodies, we alleviate suffering. When we heal imagination, we offer hope. When people regain hope, peace is not merely an agreement. It becomes a possibility. Thank you very much.